I'm Nancy Kittle, and I am a registered nurse, and I work in the cardiac rehab. I am the co-manager of that department. Cardiac rehab is a medically supervised exercise-based therapy. PCH here offers cardiac rehab as an outpatient setting. It includes exercise therapy, exercise training, lifestyle education with comprehensive risk factor modification for patients who've had heart disease. Of those patients who actually do best in cardiac rehab would be patients that have had a heart attack, if they've had heart surgery, heart transplants, we have those patients. If you've ever had angioplasty, if you have heart failure or peripheral arterial disease, those are excellent candidates for cardiac rehab and benefit tremendously from the program. The goal of cardiac rehab is really to enable a patient to achieve his or her optimal physical, psychological, social functioning so they can get back into their normal lifestyle. A new normal is what it will be, kind of a new normal. Those patients that do participate in cardiac rehab actually have a reduced mortality of all-cause mortality of up to 45%. So cardiac rehab is a tremendous benefit for patients. Heart disease is the leading cause of death for both men and women in the United States. It claims more lives than all forms of cancer. Over 800,000 Americans die per year of heart disease, which is approximately accounting for 1 in 3 people. Heart disease refers to a number of heart conditions. I kind of think of heart disease as an umbrella, and underneath that umbrella would be a variety of different heart conditions. Some of those that we see in cardiac rehab might be a structural heart disease, congenital heart disease, coronary artery disease, or heart failure. Of those disorders, coronary artery disease is the most common that we see. Anyone can develop coronary artery disease, including children. It's a matter of plaque buildup in your arteries, basically. In time, your arteries become more narrow and the blood has more difficulty flowing through those vessels. When that happens, and if your artery is completely occluded, that is when we see a heart attack occur. Approximately every 40 seconds, someone in the United States has a heart attack. We've often heard that men and women have very different signs and symptoms of heart attacks, and that might be true, but the American Heart Association says that they're very common warning signs. Of those, most obvious would be chest pain. Some patients will feel chest pain. It might be sharp, it might be squeezing, it might be pressure, it might be aching. It's different for everyone. You also might find that you have a discomfort in your jaw, in your neck, in your arm, in your shoulder. Those are also some common signs. Shortness of breath is a very common sign. Some patients become very lightheaded. They can become nauseated, and some will vomit. There's a lot of negativity that we're sharing about heart disease, but there's a lot of good news. These are factors that can be changed. You can be proactive and change these factors that we all have in our lives. You need to know your numbers, know your blood pressure number, know your cholesterol, know your A1C, know those numbers. Get physically active, that's extremely important. Manage your stress, stop smoking if you're smoking, make healthy eating habits. Choose heart-healthy options. So it's important to control your risk factors, be healthy, and just live the best life that you can live.